Okay.
Yeah, I know.
Yesterday you had a scary projection. Well, over the weekend you had a scary projection of 220,000 cases by the end of the month. Although sinabi nyo nga, because of the MECQ, mababawasan yon by about 50 to 70,000, ano? Considering what's happening now, ano yung latest sa mga projections natin? Doctors, professors.
Yeah, yung projections namin, that's right. We had to revise some projections namin. It was lower before, pero once we had that briefer with Malacanang, so we had to recalculate yung projections, and we were seeing 220,000 under GCQ. Kung mag-MECQ tayo, although kung 15 days lang, it's going to be, baka hindi mabawasan ng 50,000. Pero we're, at the same time, we're hoping na there will be a momentum carryover. Kasi like what we're seeing right now sa Cebu, even though nag-relax na sila to GCQ, hindi pa na tumataas yung numbers nila. In fact, bumababa pa rin. There is still decreasing. It's less than 1. It's nasa mga 0.75 na yata. And so that is very positive. So that's a good sign, and it's encouraging kasi we're hoping we will see this. We will be able to replicate these efforts sa Metro Manila. Of course, mas challenging dito because we're seeing a lot more cases. And in fact, baka yung mga tao natatakot sa 6,000 cases today. Pero some of it is backlog, and but yeah, we had to revise the projection. Pero we have some optimism naman. And this MECQ, hopefully, hindi lang just to buy time, but to actually decrease the numbers and to give us momentum. I think may psychological factor din yan sa mga citizens that we're able to decrease the numbers, and if we continue doing what we're doing well, then baka patuloy yan mag-decrease even if we relax to GCQ.
We want to clarify because the press jumped into this, no, and it's logical that they would focus on this. We said that if we called it that if we maintain GCQ, we would have 220,000 cases.
Yes.
If we go to MECQ, we will have something between 150 to 170,000 cases. The potential number of cases we may save, we're a bit misquoted in the press, is actually for 1 month of MECQ. So if we projected if we stay for 1 month of MECQ, we will save 50 to 70,000 cases. So this is now, if we're going on 14 days, definitely would be cut by at least half, more than half. But the point we're trying to raise here is that the MECQ was a step in the right direction. We needed it. We have been recommending it as an option since the early part of June. Whenever we submit to Malacanang and to IATF, we've been urging them to consider a stricter quarantine together with scaled up test, trace, and treat. So the MECQ by itself will not solve the problem. It has to be coupled with a scaled up strategy for T3. So this is what Professor Guido and I wanted to emphasize. The projection was for 1 month. Assuming we have 1 month of MECQ, we could reduce the potential cases from 50,000 to at most 70,000 cases. And these are just projections. And we feel, for the first time, that we will not reach our projections because we called it as GCQ. Now we're in MECQ. We feel it will become lower than that. We will get a projection lower than that. If we hit 150, then I think it's a major achievement already in terms of the 2-week MECQ. If we can keep it below 150, that's significant. That means we're all working together and pushing a strategy forward more efficiently and effectively.